And you've talked about like kind of genetic disposition to testicular cancer. So if I were to have a son, like, should he be followed more closely? And then for those survivors out there that do have sons, like, who are interested in contributing to the research, is there kind of a level to the research where their sons could be getting followed?
Yeah, I mean, so I think that's a very good question. I think we still, as a group, do not have a formal recommendation. Like, okay, if you had testis cancer, your son, you know, how we have for other cancers, like, oh, if you have colon cancer family, you should get screened earlier, right? I don't think we have that for testis cancer. And that's a very fascinating point, because I just met a patient whose sibling had testis cancer, and he developed testis cancer, and that discussion was never had, right? Exactly what you're asking me right now. And I personally think it may be because we do know that your father and brother in your own personal history, or they were one of the three highest in terms of your, what we call your odds ratio, or your chances of developing. And these are about 3 to 4 times higher. I think a sibling is like 5 times as high. If you have a sibling, it's like you're 5 times likely to develop it than the average guy walking around. I don't think it's a wrong idea. I think awareness, though, right? Self-exams, making sure we know what it is, and making sure how to do a proper exam. If there's any question, yeah, seeing someone, getting an ultrasound, and really doing that, because that should be in the thought process. Having routine screening, that's a whole different kind of discussion, right? And I think you have to think about getting into, I guess, the nitty-gritty details of public health, talking about the number. There's this concept of number needed to treat. And so, like, if you ultrasounded, and if you look at the incidence rate, right? So you would have to ultrasound 100,000 men to catch almost 1 or 2 patients, right? So it's like, okay, that's a lot of ultrasounds we're doing to only catch 2 people. But to the caveat to that is, and if you decrease that by 5-fold, it's still a lot of ultrasounds. So I think the caveat to that is having awareness and understanding is there should be a lower threshold for kind of intervening, right? You feel something, even if it's just your epididymis, which is common, we see that, which is fine. And I tell patients, don't worry, you'd rather be safe than sorry. Even if it is the epididymis, like, it's fine, get it checked out, especially if it's like, hey, my brother had it, my father had it. Like, yeah, that is completely reasonable. And I think that's something that, and it's a great point, I think that's something I personally tell patients to do. And then the other thing I tell patients to do is, if you've had a history of, say, you've done an orchiectomy, you're stage 1, we're keeping an eye on you, right, with CT scans and tumor markers. I tell my patients I want them to do monthly self-exams, not just when you're coming to clinic and seeing me for your 3-month, 6-month checkup. I want you to do monthly self-exams. And if you have a brother, and I ask all my patients, do you have a brother? They should be informed about this too. And I tell them they should be doing self-exams as well. And usually the family is there too. So I usually kind of talk with the family about that as well. But I think that's a very good point on terms of kind of just understanding who should have a lower threshold. And I think that first degree family relative is a key point.